When it comes to the response to COVID-19, do Adventists have a solution that they can add to the discussion? And should you trust the science or trust the Savior? Find out today on the Prophetic Eye. On July 29, 2021, the Associated Press reported that 94% of COVID-19 deaths were among people that were not fully vaccinated. 94% seems to be a popular number because last summer, on August 31st, 2020, news outlets reported that 94% of COVID-19 deaths were among those who had pre-existing conditions like diabetes and heart disease. Hold that thought. We're going to come back to those numbers in just a moment. On July 30th, 2021, headlines like this were all over the news. The war has changed. Internal CDC document urges new messaging, warns Delta infections likely more severe. This article states that there was an internal presentation document from within the CDC that noted that people who were fully vaccinated could spread the Delta variant of COVID-19 just as easily as those who are unvaccinated. Now, don't miss this. Evidence is continuing to emerge that people who are vaccinated can spread the virus just as easily. Other evidence is emerging that vaccinated people can carry the same viral load that non-vaccinated people are carrying. However, to be fair, it's also being said that up to 99% of people who have been vaccinated are not dying when they get infected or having to go to the hospital. But there's something else that we know based on articles like this from the Associated Press. A day before the CDC news on July 30th, 2021, here's what came out on July 29th. Israel to offer third booster shot to older citizens. And according to the article, here's why. The decision comes at a time of rising infections and signs that the vaccine's efficacy dwindles over time. The CDC is recommending that people, both vaccinated and unvaccinated, should mask up again based on information like this. There was an outbreak in Cape Cod, Massachusetts, where there were 934 cases of COVID. 74% of those people who got sick were vaccinated. Of those vaccinated people, 79% of them had, and I quote, also reported symptoms such as cough, headache, sore throat, and fever. 4 had to be hospitalized, the CDC said. So, based on articles like these, without getting into the issue of the long-term side effects of vaccines, here's what we know at face value. The efficacy of vaccines do seem to be good for a time. However, over time, the scientific evidence is showing that the efficacy for prevention or infection and severe outcomes severely dwindles over time as new variants emerge. Which is why Israel is already giving out a third dose of the vaccine, and a third dose is being discussed in the United States. So, back to our first question. With all of this uncertainty and all these discussions, should we trust the science or trust the Savior? Maybe you're looking forward to the first, second, or third dose of the vaccination. Maybe you're refusing to take the vaccine, or maybe you're hoping that the next vaccine will provide more efficacy than these first rounds. Whatever you're planning to do, here's what I know. While the efficacy of vaccines wanes over time, the efficacy of obedience to the 8 laws of health does not wane over time. So if you're vaccinated or unvaccinated, I hope that you'll pay attention as I quickly show you some of the science related to the efficacy of obedience. In this article from Medical News Today, it states that healthcare professionals eating a plant-based diet were 73% less likely to experience moderate to severe COVID-19. And those following a plant or fish-based diet were 59% less likely to get seriously ill. In other words, a little fish drops it 14%. It goes on to say that results suggest that a healthy diet rich in nutrient-dense foods may be considered for protection against severe COVID-19. Did you catch all that? Your diet can be considered for protection against severe COVID-19 based on the amount of meat that you're eating. How about this one from the University of Minnesota? Compared with COVID-19 patients who consistently met exercise guidelines, those who were consistently inactive were at 2.26 times the risk of hospitalization, 1.73 times the risk of ICU admission, and 2.49 times the risk of death from their infections. They also said that exercise is a medicine that everyone should take. There are also studies on the use of water therapy, also known as hydrotherapy, to help recover more quickly from COVID. The same hydrotherapy that was used during the 1918 pandemic and that an Adventist school named South Lancaster Academy used to aid in the prevention of any deaths, while thousands were dying every day. How about Anthony Fauci, stating that it's true that sunlight kills the coronavirus and that studies show that UVA or sun exposure make it less likely for people to die from COVID? And how about the National Institutes of Health, reporting that COVID-19 patients with a history of cigarette smoking tend to have more severe outcomes than non-smoking patients, which means that people who are temperate have a better chance of recovering from COVID. Going on with this trend, the New England Complex Systems Institute recently stated that once an individual is infected, fresh air and cleaning the environment are recommended. Something as simple as fresh air can help with COVID-19. Here's another one from Chicago Medicine, talking about getting rest. It states that ample sleep supports the immune system, which reduces the risk of infection and can improve outcomes for people fighting a virus. And finally, how about this report from the Pharmacy Times, that stress can weaken the immune system and stress and depression can potentially dampen the efficacy of the coronavirus disease 2019 vaccine, which is why people need to have trust in divine power to help them deal with stress, whether you're vaccinated or not. Nutrition, exercise, water, sunshine, temperance, air, rest, trust. 8 efficacious things that can be done starting today that, when multiplied together, can provide a high level of efficacy against severe COVID-19 outcomes. And I didn't say it. The scientific articles we just read did. In 1905, a book named The Ministry of Healing was written that lays out these same 8 principles that science is finding provides a high level of efficacy against severe COVID-19. It says that pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trusting in divine power, these are the true remedies. Every person should have a knowledge of nature's remedial agencies and how to apply them. It is essential both to understand the principles involved in the treatment of the sick and to have a practical training that will enable one to rightly use this knowledge. The same pre-existing conditions that were found to be related to the deaths of 94% of the people that had COVID-19 are the same pre-existing conditions that have been found to be absent from Adventists that follow these 8 laws of health and experience the efficacy of obedience, which is why Adventists in Loma Linda, California were highlighted on the Oprah Winfrey Show and National Geographic for their obedience to the 8 laws of health, which is why they were included as one of the blue zones. In a world of sin, nothing is 100% efficacious. At times, healthy people and unhealthy people do get sick, and some do die. But you need to know that you do have options, and you do not have to live in fear every time a new variant is discovered. And if you're seeing this, and you're an Adventist, you also need to know that God is counting on you to live in faith, not fear. He's counting on you to be careful, not fearful, as you experience and share the efficacy of obedience with others who don't know. If you'd like to dig into this topic more, check the description below for some of our other videos on this and other topics. And while you're doing that, ask yourself a question. Based on what you've seen today, should we trust the science or trust the Savior? That's up to you to decide for yourself. But as for me, I know that time will always reveal that true science will always be in line with the guidance of the Savior.